Cancer affects millions in this country. The disease is any malignant growth or tumor caused by abnormal and uncontrolled cell division. The month of October is earmarked as Cancer Month. 28-year-old Karissa was recently diagnosed with breast cancer. She's currently undergoing chemotherapy. She joins us to tell us a story. Good morning to you.
Good morning.
Welcome. Thank you for joining us.
Thank you for having me.
Okay, so tell us about your story, about your journey. What actually happened?
Well, my journey starts with the fact that I have a fantastic doctor who taught me how to do self-checks, breast checks, on a religious basis every month. And because I am aware of how to do these self-checks, I got diagnosed quite early. I found a lump. I then went to my doctor. We did ultrasound.
Okay.
And from there, moved over to a mammogram and a biopsy, which then confirmed that it was cancer.
Yeah. So how would you characterize your cancer now?
My cancer is not such a great one. It's aggressive, which means it's fast growing.
Okay.
But it's important for everybody to understand that stages vary. So saying that stage 1, stage 2, stage 3 doesn't really mean anything in that everybody's cancer is unique.
Yeah.
And everybody's cancer is quite unique to them.
And they respond uniquely to it in a sense.
Exactly.
The body responds differently.
The body responds differently. Yeah. I must say, I believe strongly that my youth and my health will play a big part in my recovery, which is why I'm so positive about this.
Yeah. Let's talk about, when did you learn to do the self-tests and how did that come about? Was that a conscious decision? Was it by accident? How did you learn that?
I'm a thorough person by nature, so anytime I consult with any doctor, I ask them a million questions. Yeah. And my first consultation with my gynecologist, you know, gynecologists do breast checks when you're in the doctor's room. So I asked why, I asked how to do it, I asked how regularly should I do it. It's important that you do it at the right time of the month. For women who are premenstrual, they're more likely to have lumps that mean nothing and will go away. So I learned all of that at around the age of 20, 21.
Okay.
And I've done it every month.
So is it a question of the earlier the better?
To get into the habit of it, absolutely.
Yeah.
I mean, in South Africa, the statistics are 1 out of every 9 women get diagnosed with breast cancer. And it's not an aging anymore, as you can see by me.
Yeah.
You have to get into the habit of learning that you need to do this, to be aware, and to diagnose early. Breast cancer is the second most common cancer in the world, and there's a 95% survival rate if you catch it early.
So with the chemo that you're undergoing, how are you responding?
I'll be having my second chemo this week, Thursday, so I'll actually be able to tell exactly how my body is responding, but I believe that my body is responding well. I sit here today feeling quite good. I feel that the doctors feel that my body is going to react well to the treatment. So we're just going to pray and do everything that we can medically to make sure that my prognosis is good.
Okay. The testing, you say it must be done at the correct time of the month.
Yes.
When is that?
Post your period. So not when you're
post?
Yes, a few days post your period, not when you're premenstrual, because your body's full of hormones and your glands swell, etc.
And when you test, how do you do it? What must you do?
So when you test, it's preferable to lie down and you check from the outside in with the flat hand. Ladies would know their bodies. They'd know where, you know, if something doesn't feel right. And the best thing to do is, if you're not sure, just go and get it checked by a doctor. And you'll feel, for myself, lumps feel different. So I can't tell you that it's going to feel like this or it's not going to feel like this. But you will be able to tell that something's not normal, how it should be. So if you get into the habit of doing it once a month, you will also be able to tell this is normal, this is not, and get used to your own body.
So that's the advisable sort of approach.
Yes.
Once a month, do it post your period.
Yes.
And then lie down.
Yes.
And then use with a flat hand.
Yes.
Yeah.
My doctor has a very good website, breasthealth.co.za. There are good techniques listed there, as well as cancer prevention foods that you can add to your diet. Just incorporate little things like green tea or rooibos tea.
So you've changed your diet as well, presumably?
Yes, I have.
Okay. What have you incorporated? What have you gotten rid of?
Well, all junk food, unfortunately. But added a lot of fresh fruits and vegetables, and I will be doing a better, more cleansing diet post my chemotherapy. Right now, during chemotherapy, it is quite difficult to eat, so my doctors focus more on the fact that I actually am eating than what I'm eating.
Okay.
Yes.
So you're going to do something special for us today?
Yes, I am.
Okay, tell us about it.
In solidarity with the amazing women that I've met who've been through this, including my own grandmother, and women who are going through this right now with me, I'm going to be shaving my head.
Okay.
Yes.
Will you keep the, I don't know, the headband?
Maybe, I don't know. We'll see how I look.
All right. Okay. Thank you very much.
Thank you very much.
Thank you very much for the boldness with which you tell the story.
Thank you.
Okay. All right. Thank you very much for joining us this morning. So, Karissa will shave her head, and we'll show you that at the end of the program. You're watching Morning Live on SABC2. Now, what we're going to do is, it's 11 minutes before 8 o'clock. We're going to go to a break. When we return, there's going to be the final news bulletin. Andile will tell us about the weather, and then, of course, we'll turn the studio into a hairdressing salon. Let's take a break. Morning Live continues after this.